folks who've been around here for a while will know that Brooks Falls actually used to have a hospital. So
Hmm.
it was a Red Cross hospital initially. It was actually built in 1949, which was the same year one of the original Huntsville hospitals was built. If you look at a picture of them, they look identical. So we did have a hospital in Brooks Falls. There was a lot of anger and angst when it was closed. This is the final services left in 2009, but a lot of that had actually left even before that. So the kind of the initial reaction is anger and frustration and all the natural things. Maybe that's what we're seeing in Bracebridge. I'm not sure, although I don't see that they're losing a lot. They're getting a brand new hospital, so that that part is interesting. But what we determined after kind of 7 or 8 years of fighting things is that we had to take a more positive approach, and we had to look that things were going to change, as they said. Healthcare can't be delivered the way it is today. If you look at the burnout rate of our healthcare providers, the amount of work they're taking on, COVID just kind of was the tipping point, I think. But there's a lot of stress on the whole healthcare system, really, and that's what we need to look at. So we took a different approach, and that was we want to work together with our partners, whether that's the Muskoka Area Ontario Health Team,
Hmm.
the hospital themselves, and certainly the providers in our region. There, we want to make sure that our healthcare providers are working together. It's not a bunch of islands around the whole region. And so we basically kind of changed our own attitude and took a different approach, and that's been over the last probably 5 or 6 years, and we feel that that's the way to go. That you have to, again, have to work together, have to pull together. There's not one municipality that can do this on their own. This is a monumental project, $1 billion project for an area that has a population of, say, between 60 and 80,000 in total,
Yeah.
including our area. So it's a big project to take on, and as I say, we have to pull together. And if you're looking from the outside in at some of the arguments that are going on, it's got to be frustrating for people who in other communities would love to have this kind of opportunity are not getting it.
Mayor Ward says there is also a concern within the Almaguan community that pulling back on the local share promises around the region could take the whole project off the rails. But chair of the Save the South Muskoka Hospital Committee, Bruce Kruger, disagrees with that sentiment.
We've heard this nonsense for years and years, right back to 2015, that if we don't get this in right away, we're going to lose our order for the financing from the Ministry of Health. This has gone on and on. Well, each time they keep coming up with this excuse. And that's what they said back in January 29th in Dwight, when Muskoka Algonquin Healthcare first said that they had started a new model completely from what we thought we were getting from 2015. And as a result of that, it just hasn't worked. But they said if we don't have the submission in by March, we're losing all the money. Well, March has come and gone. We still are in the arguing stage, but the Ministry of Health certainly hasn't cut us off. Our member of Parliament, the Honourable Graydon Smith, he's assured us that until we get things right within the Muskoka Algonquin Healthcare, that it's not going to proceed. He would not support it, and therefore he's assured us that in fact the money will be there, but not until we get this correct, and so that all medical doctors can feel satisfied with what's coming into Muskoka.